Hello, everybody. This is Dr. Anu Chawla. I am practicing as a senior specialist in the reproductive medicine and surgery for the past 13 years, mainly in the private sector, but also in NHS, where earlier I was a senior specialist in the reproductive medicine department of St. Bartholomew's Hospital, which is the first and the largest NHS trust of the United Kingdom. So the reason I chose this branch of medicine, which is reproductive medicine, actually is very special. This is the only branch in medicine where we do not take out something out of the body, but we actually put in something in the body. It's very interesting. It's a very science-based branch. It's a very technology-based branch, and I've been very, very technology savvy, even as a child. When I opt for the subject of obstetrics and gynecology, even before the training, I was so sure that I'm only going to do the obstetrics for my training aspect. And soon after my training, immediately, I first did a fellowship in the endoscopic surgery in gynecology. And I'm very proud that on the 6th September 2011, our team was the first team in the world to do the first 3D laparoscopy gynec surgery. So this was one of the highlights of my career. Soon after, I was absorbed in the reproductive medicine because I used to do hysteroscopies for some of the units, and I developed this interest very deeply, given the sensitivity around this branch, and went to various countries, United Kingdom, Oxford, USA, in Norfolk, Virginia, EVMS Jones Institute, Shady Grove Institute, and some of the very reputed ones, which is like the Center of Human Reproduction in New York, Manhattan, by Dr. Norbert Gleicher. So I extensively traveled and saw different ways how people practice reproductive medicine, and ultimately gained expertise in conventional IVF, and then mild and moderate, and natural and modified natural IVF, and followed by a very rarely practiced area of reproductive medicine, which is the reproductive immunology, which should ideally only be offered to a selected patient group, because it is still in its evolutionary phase, and it's not completely evidence-based, but only those patients where it might have some role after extensive counseling. We do practice that also. So the most rewarding aspect of this job that I do is actually a satisfied patient at the end of the treatment. It is, like I said earlier, in medicine, generally we see patients, but these women and couples are not patients, they are general public. And the most important aspect becomes the safety. So if somebody who's a normal person just trying to conceive ends up in a complication, that is actually something which nobody wants. So it is very important to be in a safe and expert team whenever you go for such a treatment, because obviously we know largely it's a very safe procedure and widely practiced as of now. But there are some important areas like stimulation and egg collection, which actually have to be done considering the safety, because that is the aspect of IVF, which can actually have certain complications, which are known complications, but our job is to decrease it as low as possible and still have a very good outcome. We know that this branch has now diversified a lot. Earlier, around 13, 14 years back, when I first started my practice, it was mainly just conventional IVF. But now we have various varieties of the technologies under the umbrella name of IVF, starting from just egg freezing or even sperm freezing. Egg freezing actually gives the wings and biological insurance to young women. So that is a very satisfying part of my job. And then obviously some of the oncology patients are coming these days to freeze their gametes before their chemotherapy or radiotherapy starts. So that is also another developing area of this practice, but mainly our practice is focused on couples who are aiming to have a child. So that is the most rewarding part of my job when a couple has a child at the end of the treatment. Some of the areas of the practice are very close to my heart. For example, recurrent IVF failure, for example, endometriosis, and polycystic ovarian syndrome. Especially, I actually have been very active in our gynec organizations when it comes to endometriosis. And very proudly so, recently I've been elected unopposed as the chairperson of the endometriosis committee of the Federation of Indian Organization. Also, in this month of October 2023, I will be actually taken as the committee member in our International Federation of Obs and Gynecology, which basically has a headquarters here in London. And that would be another platform for me to do my role, not just as a practitioner, but also as a leader for certain areas which are still in the developmental stage of research, awareness. For example, I have seen that when a patient complains of pain during periods, many times she is told it is in her mind when actually it is in her pelvis. It is in the form of endometriosis many times. The average age of delay of diagnosis of endometriosis starting from the first complaint to the actual diagnosis in the UK is 8 years. And we really need to work on this area. So apart from my practice, I'm very sensitive to other responsibilities to the society as a doctor, which I address through my roles in these organizations and gynec federations, be it the Royal College of Obs and Gynecology, where I keep trying to get involved in whatever projects where I can give my volunteer contribution, Indian Federation, where I do have office-bearing roles, and also the International Federation of Obs and Gynae, which is a very respected organization, the parent body of all the Obs and Gynec federations of all the countries headquartered in London. So this actually is the way how we can do the needful and advance the practices. When we speak about special moments of my career, always the most important special moments of my career are when my patients give me a good news that they're pregnant, and more so when actually they deliver and the baby is in the lab rather than just a clinical pregnancy test positive. The other important high points of my career, which I can remember, are I was one of the team members who performed world's first 3D laparoscopy gynec surgery on 6th September 2011. There were many high points during my training years, where I actually trained in 3 countries, in India, in UK, as well as in US. Recently, what I can recollect, one of the high points was working through the pandemic for all the patients who needed IVF. And recently, I actually organized an event in the House of Commons along with 3 main organizations of the world, where all the leadership of the Royal College of Obs and Gynae, the International Federation of Obs and Gynae, and the Indian Federation were present, all the presidents, vice presidents, and we actually felicitated and awarded 120 high performer IVF doctors and also those who sustained the services during the pandemic. And I'm very proud that I floated the idea and executed the whole event almost single-handedly. And it was organized in a very prestigious venue of House of Commons in London on 29th June 2023. And I hope I'm able to do these kind of things in future as well, where it is very important that everybody who's contributing to this subject of assisted reproductive technologies should be recognized every now and then. So it just helps them keep oneself motivated so that the subject as a whole actually advances through that. Patients actually want to take every extra last percentage of chance to have their own child. And this is only possible when researchers, scientists, and doctors continuously invest their time, energy, mind, emotion, passion into the subject. And for that, it is important that they are recognized. So coming back to the main thing, which is our patients, is at the end of the day, the main beneficiary of anything that we do is our patients. So every extra effort is worth it when we have even one more positive result in the form of one more child when a couple really wants it.